Good morning, everyone. I'm Marie Clary Fishman. I'm the Vice President of Clinical Quality with the American Hospital Association and also a nurse. Joining me today are Michelle Davis, the Assistant Vice President of Medical Services at Unity Health in Searcy, Arkansas, and Jamie Wynn, the Clinical Education Consultant with Spacelabs Healthcare. So glad to have you both with us today. We're going to have a great conversation this morning. So since COVID has been part of our world, the pandemic has caused us to need to really increase collaboration between clinical teams, empowering our nurses, and increasing patient and workforce satisfaction have really become even higher strategic priorities for hospitals and health systems. And it becomes clear that the field really must begin looking for ways to collaborate and to enhance their governance models. So, Michelle, let me talk with you and ask the question about your experience using a shared governance model at Unity Health. How have you seen it succeed, and what challenges has the team faced? And you can give us a little bit of a perspective on your COVID experience as well, before and after COVID.
Developing a shared governance model here at Unity has increased our nurse engagement and our collaboration between our multidisciplinary teams. It's empowered the clinician at the bedside to have a voice in our organizational policy and procedure development, and that's resulted in improved patient outcomes as indicated in our patient satisfaction scores. COVID has brought many challenges for us, but it's also been an opportune time to let our nurses feel supported. It's important to us that our staff continue to feel supported and that they have a voice in the face of this pandemic.
Those are really important things to focus on. I know that you've also included lean principles in that as well. Can you talk a little bit about how those principles have fit in your shared governance model and what impact those have had on your clinicians? And then I'm also going to, Jamie, ask you to give us a little of your thoughts about that as well. Michelle, do you want to just start us off and we can have Jamie give us some more comments about that?
Yes, ma'am, thank you. I've seen this play out through improved efficiencies of our staff, the standardization of processes. It's allowed my nursing staff to have more time at the bedside with the patient.
I would say, so this is Jamie, I would say lean processes fit with shared governance. Lean methodology thinking and lean processes are designed for efficiencies, and shared governance models are designed to give a voice to those that do the work. So, from my perspective, those that do the work know how to do it better and they know how to improve their productivity and remove any wasted time. We, as healthcare nurses at the bedside, often say, why are we doing this? Can we do it differently? Oh, this would work better. And that's lean thinking in itself. So, lean thinking added with going to the table and having a seat at the table to change those policies and procedures, as Michelle's kind of pointed out, really just gives them a voice to improve processes, make things better.
Thank you. And Michelle, do you have any specific examples of that lean thinking where you've seen the clinicians really get involved? I know one of the things that nurses frequently ask for is to have that voice. And so you've done a great job with shared governance and giving nurses that voice. Any specific examples that you would want to share with us?
One example that we used here at Unity was we standardized some of our EMR flow charts to be more productive with our rounding times. We just moved things around in the flow charts, and that really assisted the nurses in being more efficient and spending less time charting, and that provides them more time at the bedside.
That's a great example, and having personally experienced that when my dad was a patient in an ICU. Can you tell me a little bit about how that culture change and that rounding really, how that impacts patient satisfaction?
The more time you can spend at that bedside with that patient, the more the patient feels like you're engaged in their care and providing exceptional care to them.
Thoughts about the impact of the lean principles and the rounding on patient satisfaction?
Absolutely. I mean, they all work hand in hand together to just improve patient care and outcomes, which is everyone's goal is to stay focused on patient care and how to improve the care of the communities really and the patients. So patient satisfaction just naturally will come when you do the right thing, you improve, make good processes, and continue to grow your knowledge, and your processes grow over time. I know technology is a huge part of what we do in healthcare today. So, just being able to use technology to provide actionable data when we need it and where we need it is also going to improve the overall patient experience.
That's a great point. It's really been important to get data and information into the hands of those at the bedside, those that really can impact and change care right as it's being given. So that's a really great point. And I love the connection between a shared governance model, lean, and technology. That's really getting all the pieces together. So, if you were going to give some advice to other organizations or give them some insider knowledge because you've already been there, if they're looking to adapt a shared governance model and lean principles, especially if as you move forward, post COVID, we really want to build on lessons learned and make things better from all the experience that we've had. What would be some of the things you'd want other organizations to consider when they go to adopt this kind of model for themselves? Either Jamie or Michelle, whoever wants to jump in first.
Be dedicated to the process. You're going to have to be agreeable to change. And you need some quick wins for the nurses to gain the staff buy-in and participation into these councils.
Great, thank you. Jamie?
Sure, I'll just add to really listen to those that are doing the work. They do it every day. There's no bad ideas. Allow them to express, create a safe environment for bedside caregivers to have a seat at the table and express any idea. And again, listen. As Michelle said, you got to have wins. I've seen that. I know Michelle has as well. The wins will engage, motivate, and inspire others to continue, bring in other ancillary departments. And I really would encourage organizations to really consider what are your goals with shared governance, and where do you want to be? Where does your future look like? Where do you want to be? And stay focused on the patient as you make those progresses and improvements and change. Process improvement is every day in healthcare.
Those are wise words from both of you. Could I ask a question about an example from the time of COVID? How did this really help in a particular situation during COVID? Do you have any ideas or thoughts about that might be helpful to the field?
I can speak to what we've seen from a technology perspective. The demand has grown to help caregivers be more efficient and have data when they need it, where they need it in their hands. So, from the technology perspective, providing opportunities to reduce exposure and just improve efficiencies and help through the COVID pandemic has been a great demand, and we've had many opportunities to do that.
A couple of things that, as Jamie mentioned, the technology, in order to keep shared governance at the forefront, we utilized virtual meetings. So it was real important that we continued to have the monthly meetings. Some of the things that come out of those meetings were the need for therapists. The nurses are stressed. So we did bring therapists into the hospital. They would round on the units, and then we made them available at nighttime for the staff to go up. We did waive all fees for our associates because it was important to us, their well-being.
That's great. Great perspective. I think that focusing on the well-being of clinicians certainly is so important to the resiliency of our healthcare systems in this time of stress. So really, really great work. Michelle and Jamie, thank you so much for joining us today and for being willing to share your insights and your thoughts and the great journey that you've had at Unity. Really appreciate it. And I'm sure that other folks in the field who are interested in going on this kind of journey would love to reach out and hear more from you. So thank you so much. We really appreciate it. Our patients and our frontline caregivers really appreciate it as well. If you'd like to learn more about Spacelabs Healthcare, please visit www.spacelabshealthcare.com. and learn more and find some ideas for this great transformational work. Thank you.
Thank you.
Thank you.